Am I on? Oh yeah, I am on. All right, so we're going to talk about chapter 9, cardiovascular system. Cardiovascular system, what you want to know is the following. Rule of thumb, what's the fun? Yes, that's what it was. That's what it was. Good. Good check on me. Thank you very much. Page 207. You want to know the layers of the heart. What are the layers? And the reason you want to know layers, the most important layers you want to know is myocardium, because myocardium does all the work. Let me tell you about the little trick about studying eagles. The very first thing you want to know, let's go chapter 9, page 206. What you want to know is chapter outline. Are you able, after reading chapter 9, are you able to tell me functions like anatomical function of the heart and the vascular system? Anatomical function of the heart is to push blood forward, to pump blood forward. That's the anatomical function of it. What about vasculature? Vasculature, think of it as a pipe, as a piping system. Piping system throughout the house, throughout any structure, takes the water from the street into all over the house. Blood does the same, vascular system does the same thing, takes the blood all over the body. That's the difference, that's the relevancy of it if you want to know. So that's a chapter outline. You should be doing this. Write down heart, and you should put down as much as you can about heart right next to it on a blank piece of paper. Next, you're going to write down vascular system. Right next to it, you want to write down as much as possible about vascular system. And when I'm talking about vascular system, you're going to write down pulmonary system, systemic system, or pulmonary circulation. So pulmonary circulation, I'm going to write down as much as I can. I'm talking about the veins, I'm talking about the arteries, it comes from where, it goes to where. And then I'm going to do systemic circulation. And with the systemic circulation, I want to write down whatever comes and goes into the systemic circulation. Number one, what I want to know is the very first thing after systemic circulation is coronary circulation. And then there's a couple of other circulation that takes the blood into the head. At least I want to know what it is. I'm not saying all the details, but few names. Brachiocephalic arteries that takes up the blood up there. Another thing that I want to know is bronchial. Bronchial circulation feeds the lung tissue itself. Pulmonary circulation is all about gas exchange. Pulmonary circulation feeds the lung tissue very minimum. Bronchial circulation feeds the lungs tissue itself. You see what is happening. Just because blood goes through the lungs doesn't mean they get fed. Another circulation under systemic circulation feeds the lung tissue, and can you tell me why? Why pulmonary circulation does not feed the lungs only and only? Why we need to have bronchial circulation? Because systemic circulation is O2 rich. Pulmonary circulation is O2 poor. So O2 poor is not able to feed anyone. If I don't have any money, am I going to be able to help you, Josh? Can I get you lunch when I don't have any money? No. But if I have a lot of money, like systemic circulation, then I can get you a lunch. Not that I would, but just an example.
Come on.
All right. So this is how you should be able to put it down. What else? Pulmonary circulation, pressure. Systemic circulation, pressure. Is there more to put on? A lot more. A lot more. Pulmonary circulation. We're talking about right heart. Systemic circulation. We're talking about left heart. Pulmonary circulation. What's important for you to know is right ventricle. Systemic circulation. What is important for you to know is left ventricle. And then here comes all the diseases that you're dealing with. For example, on the right side, if you have problem, you're going to develop pulmonary hypertension. On the left side, if you have problem, you call it systemic hypertension, but we don't, because it's something customary, we all are familiar with it, we just normally call it hypertension. So as you see, I'm going to start putting one by one by one. Well, today, if you can put 2, make sure tomorrow you can add another 2. And then next day, come back and add another item and another item. Because what you're going to do is pulmonary hypertension. What can you do for pulmonary hypertension? What kind of a drug you can give them? What kind of a gas you can give them? You can give them nitric oxide. Excellent. Do you see what is happening here? You keep going about it, how to fix situation. Pulmonary hypertension, if you don't fix, is going to cause some sort of a cardiac issue, some cardiac problem. You want to fix that. Little by little, you're going forward to fix the stuff that you need to do. Fix the diseases, illnesses, and so on and so forth as it goes through. That's why you need to know the layers. That's why you need to know the details, because you can connect the dots together later on as you go through. Please be sure to know cardiac tamponade. What is cardiac tamponade? Cardiac tamponade is this. Think of the heart as it is located inside the double ziplock. You have 2 ziplock inside of one another. And then you have the heart inside the ziplock. Between the 2 ziplock, you need to have a little fluid to decrease the friction. We call it, what do we call it? It says it right there. What we call it is this. Look at what it says. What'd you say? Pericardial fluid. Just like a pleural fluid, precardial fluid. That's what we call it. Or that's what it's called. If for whatever reason, due to injury, this pericardial fluid starts increasing and going up, what do you think is going to happen to the structure of the pump? Do you think the pump can function? No. As a result, you are going to see on EKG, and of course you're going to see it in other signs and symptoms as well, that patient is going to cardiac tamponade. Cardiac tamponade meaning that left side of the heart is not able to pump blood, which means cardiac output is down. If cardiac output is down, circulation is compromised. If circulation is compromised, oxygenation is compromised, which we call it. If oxygenation is compromised in our body, we call it hypoxemia. Hypoxemia is going to cause us tissue death, necrosis, and these are not good stuff. So what do we want to know? We want to know if it is tamponade, we need to do something about it. Okay, this is something we need to know, we need to understand. Any questions so far? Yes, no? Okay, good, let's go. 208. 208. What you want to know is figure 9-2, you just want to look at the left ventricle wall. It's really thicker than the right side. You see it. Myocardium, myo stands for muscle. Cardium refers to cardiac. So muscle of the heart or muscle of the cardiac is thicker on the left side. The reason, because it has to work against a greater pressure. As a result, becomes thicker. As a result, becomes bigger and thicker. So when we are talking about here, 120/80, we talked about we are experiencing a greater pressure. As a result, muscles are becoming really, really thicker. versus the right side, pressure is lesser compared to the left side. As a result, muscle thickness becomes smaller. That's how the difference you're going to put next to it. As you look at it, what am I doing? I'm keep adding information to what I have in front of me. And the reason behind it, I can have a reference. I can put the 2 and 2 together. I can have a better understanding of what exactly I'm talking about. Why muscle is thicker? Because of a higher pressure. And why is it higher pressure? Because we are experiencing a higher resistance versus lesser resistance. And if you look at it, pulmonary circulation goes either side and this side. From heart goes to the right lung and a left lung, really a small distance. As a result, we have less resistance. Then we need to generate lower pressure to overcome that resistance. Systemic circulation leaves the heart and goes all the way to the fingertips, all the way goes to the toes and head. So it has to travel such a large or long distance. As a result, it has to go against a greater resistance, so it needs to come up with the greater pressure to overcome that resistance. Please be sure when you get home, look up the following words on dictionary and I can understand what is resistance, what is flow, what is volume, and what is pressure. These 4 are not going to leave you alone till you become RRT. And once you become RRT, it's just the beginning of the era. You're going to have to deal with this a lot over and over and over. You want to look up what is flow. You want to look up what is pressure. You want to look up what is volume and what is resistance. And another thing you want to know is that any system works in our body, works, it has to have at least 2 functions. Remember that? Yes, thank you.
Fine.
So any system in our body that wants to be a system, or on this universe as we know, or on this planet as we know, anything you wanted to function and work as a machine, as a system, should have 2 functions. You drink water, and then also you urinate. Does that make sense? You eat food, and also you defecate. You fill up your lungs with air during inhalation, and you also bring the air out by exhalation. You pump blood out of the heart during contraction, and then you fill up the heart with blood during relaxation. What are we saying? You're going and you're coming. 2 functions. Everything comes at least in a set of 2. How many eyes we have? 2. How many ears? 2. How many lungs? 2. How many kidneys? 2. How many heart? Oops. 2 what?
Pumps.
2 pumps. Very good. 2 pumps in one structure. So do you see? Everything comes in a set of 2. That's how it's designed. We're going to talk about other stuff also. Even our receptors comes in a set of 2 because they're going to give us feedback. So we just want to understand how things are working. Put it into perspective. Function and a structure. The structure and function. And if you look at it, left side or left ventricle, if you look at the structure, this is the structure, which is thicker. What is its function? To overcome a high resistance, which needs to come up with larger pressure. Same applies to the other side. Right ventricle, lower pressure. Okay, the structure is smaller. Its function is to overcome a smaller resistance, so it generates a smaller pressure. Again, we're going back. You see, everything we want to study, if we put it and structurize it, organize it, it's easier for us to understand. rather than just remembering and memorizing a few stuff here and there and here and there, because at some point our system or our brain get oversaturated. All right, page 208, you want to understand that rule of thumb and memorize that rule of thumb. And then on that same page, right column, you want to know what I asked you to highlight is third line. Right column, third line, beginning of the paragraph says, common valve problems, highlighted to the end of the paragraph. And please do so, because this paragraph is the paragraph that you will be dealing with a lot and a lot and a lot. And that paragraph is the paragraph that, correct, regurgitation and stenosis. That's the one you want to know. That's the one you want to know really well, because you're going to deal with it during hemodynamic monitoring. You're going to deal with it during mechanical ventilation. Or, you're going to deal with it during pathophysiology, so on and so forth. And during your clinical, you will see a lot of patients are done open heart surgery. And you're going to find out why, because they had a stenosis. What do you mean a stenosis? So again, you're going to look up on the dictionary, what does a stenosis mean? What does regurgitation mean? So that way you can put the 2 and 2 together. And what I suggest everyone, because I do it myself, and I suggest, that's an advice to everyone, is this. Any word that you don't know, look up on dictionary and know it, because then you own the material. You don't understand, you comprehend. It's different than understanding. Understand is, you explain to me, I say, I understand. Sure, but can you come back and teach me what you just learned? That's comprehension. That's a deeper level of understanding. Understanding is here, comprehension is deeper. So that's what you want to know. What you want to know is this, that you want to get up on the board and explain to me what is a stenosis and what is it going to do to the pressure, to the resistance, to the left ventricle muscle mass, and you go forward. That's what you want to know. That's what you want to do. So please be sure to know that one. Coronary circulation. It's in italic. 5 lines before the end of that right column. So you want to highlight that it says coronary circulation. So be sure to know that and understand what's going on there. Page 210, left column, you want to know line number 5. The sentence starts, blood flows through the coronary arteries only during ventricular diastole, to the end of that paragraph. And please, please, please study what I just asked you to highlight to the end of the paragraph, because absolutely and extremely important for you to understand what we're talking about, because it talks about coronary circulation, and that coronary circulation has a lot to do, and I hope all of us understand what we're talking about when it gets to that part. Mini clini right next to it. Do you see what it says, the topic? The title of that mini clini is mitral stenosis. Now the question is, if you do not know where is mitral valve, this is the moment that tells you you need to know it. So be sure to understand where is mitral valve, connects what chamber to another chamber, because when you get to hemodynamics, you will be dealing with mitral valve a lot and a lot and a lot. You need to know it. It's a good understanding you need to have, so be sure to study it and know it. Okay, so then we're going to get to another mini clini, which is heart rate and coronary perfusion. You need to know that one because it's extremely important. So make sure you study it and know it, see what's going on. Page 211. Page 211, right above the figure, you have something in bold that says Frank-Starling law. Dr. Frank and Dr. Starling, these two physicians, or I should say physiologist physician, they came up with this result and they found out Frank-Starling law. Frank-Starling law explains that the more a cardiac fiber is a stretch, the greater the tension it generates when contracted. Well, it can be a little confusing. Let's break it down to something less confusing. And less confusing is this. If you get the rubber band in your hand, and if you stretch it far, the farther you go on the stretch, the greater force you will generate. That's what it means. If we fill up the heart with more volume of the blood, it says that fiber, the cardiac fiber, or myocardium exactly, what does it do? It allows it to generate a greater force, which would be the contractility. That's what we're talking about. Do you need to know this? Absolutely. Will I ask you a question when you get to clinical? Absolutely. This would be your exam question? Absolutely will be. You can ask everyone. I always put that on the question because that's the concept. I am more concerned about concept than just quantity. Anyone can memorize what's the heart rate, what's the normal respiratory rate, what's the normal pressure. Anyone. But what I want to let you know, what I want you to take from any class is how much you learned concept. That's why I ask to study what is pressure, what is resistance, what is volume, what is flow. Because once you know the concept, the rest is just decoration. Memorizing material is decorating your memory. What you need to know, the trunk of your brain should be upon concept. Should be upon concept, knowing the concept. Okay, any questions so far? No? All right, let's go then. Next page, 212. Page 212 has a beautiful diagram, figure 9-6. Again, if you don't know blood flow, this is another picture. This one tells you about O2, CO2, lungs, heart, and everything above and beyond. Systemic circulation, pulmonary circulation, how things are taking place, so on and so forth. So be sure to know that part also. So page 212, right column under the heading systemic vasculature. It says number 1, arterial system, highlight. Number 2, capillary system, highlight. Number 3, venous system, highlight. So be sure to highlight it and know it. And then what you need to know is the nickname for these. Nickname for arterial system is conductance. You're going to find it in page 213. Page 213. Count down 2, 4, 6, 8, 9. Let's call them line number 9 towards the end. It says conductance vessels. They are arteries. They are arteries. They are conducting the blood throughout the body. And then we're getting next one. We're getting into capillary system, which is in italic. And then fourth line, it says exchange vessel. So if you look at it, it tells you the structure and function again. Because when it talks about arteries equals to conductance. Conducting the blood. The structure, function. Then talks about capillary. At capillary, what do we do at capillary? At capillary, we don't do anything but one major function. And that major function is exchange. What are we exchanging? You can think of it as this. Capillaries are like any port. It could be airport. It could be seaport. What do? We exchange. Passengers are coming and passengers are leaving. That's airport. Seaport. Trades are coming and trades are leaving. Exchange again taking place. And then Venus. For Venus, we have another name also. So you can write down or you can highlight that part also. That would be on the right column 213. First, second, third paragraph at the end in italic, it says capacitance vessels. Want to find out, what does that mean? Why does it say capacitance? What do you think? What does capacitance mean anyway? Capacity. Thank you. So why out of these three, this one is capacity? Why? Holding how much?
3/4 and 1/4.
So you are telling me 75% of the blood resides at the venous system. That's a lot, isn't it? That's why it's capacity, or capacitance to begin with. Does that make sense? Okay, very good. Something else for you to know is the next paragraph after capacitance is the venous system must overcome gravity. Please highlight it and know it. Number 1, sympathetic venous tone, because veins are not having as much muscles as arteries do. Large veins are having the sporadic muscles. What type of muscles we're talking? What kind of muscles are covering arteries and a little bit of the veins? Smooth muscles, thank you. Smooth muscles are the one that are holding onto arteries and some of the veins. So those muscles, it's not a lot, it's like a sporadically here and there. Those are having little tone. We'll call it sympathetic venous tone. That's what they're talking about. And then number 2, a skeletal muscle pumping or milking per se, because every time you go and donate the blood, what do they do to you? Isn't it that they say, start squeezing? The reason behind it, every time you move the muscle, who does the work? Muscle, right? Muscle do the work. Every time you move the muscle, you cause something to be moved, and that is blood in that case. So that's what we're talking about, skeletal muscle movement. And then number 3, cardiac suction, meaning that atrium dropping the blood into the ventricle, now they have no blood in there, they suck the blood into the atrium by suctioning mechanism, so that's how blood comes back into the atrium. That's how it works in the venous system. And number 4, thoracic pressure causes. Well, Boyle's law explains that we have pressure and volume that are inversely related, meaning that during inhalation, what did you do to your thorax volume? If you look at my thorax, what did I do during inhalation? Did it get bigger or smaller? It got bigger. So if it got bigger, if my thorax got bigger, what happened to the pressure inside? If they are inversely related, pressure went down, meaning that volume went up, plus sign, pressure came down, negative. What do we have in our thorax? We have 2 major structures, lungs and heart. If the pressure inside the thorax goes below, it becomes negative, air goes in. What do you think is going to happen in the heart? Blood goes in. Blood fills up, lung fills up with air, heart fills up with blood. You see what is happening there? Okay, let's recap it again. Since pressure inside the thorax drops below normal, everything moves. Again, in this planet, everything moves by gradient. What does gradient mean? What does gradient mean? What does gradient mean? Yes, you do. What does gradient mean? You're right. That's what we use, but what does gradient mean? I'm looking for gradient. Thank you. That's what I'm looking for. Do you see what is happening there? I'm looking for the word, because half of the battle is done by knowing terminology. So what does gradient mean? Say it again. Difference. Thank you. So we're talking about difference. Difference. Always everything moves due to difference. Otherwise, there's not going to be anything moving. And I'll tell you what. You fill up your tanks with gas. Full tank, right? Once it gets empty, will it move? No, it will not move, because there's nothing to move base. And here's what it is. Higher height to lower height. It moves. Once it reached right there, it's not moving anymore because there is no difference. There is no gradient. So look at this right here. Right here, this pressure, ambient pressure, we talked about, or barometric pressure is, what do you think it is? Barometric pressure is what? 760. At sea level, let's say if right now this room is 760, what do you think is going to be inside of your lung during inhalation? It's 755. You guys told me that air moved into the lungs due to gradient, from higher to lower. Does that make sense? Right? It just goes this direction. Okay, that's fine. But then, what about during exhalation now? What are we going to do during exhalation? During exhalation, what happened to my volume of the thorax? Did it increase or decrease? Decrease. Okay, it decreased, and you are absolutely right. What do you think is going to happen to the pressure now? Pressure is going to go up. Okay, pressure goes up. Okay. Let's find out what's going on here now. Pressure went up. Now pressure went up to 765 millimeters of mercury now, and outside barometric pressure, you told me is 760 already, right? Now the question I have is, gradient moves. So if gradient moves from inside the lungs goes to room air, and this is inside the lungs. So are you telling me that everything moves by gradient? That's what you did during inhalation and exhalation. Same thing works inside also the heart, because you told me. This right here. 120 is during contraction, high pressure. 80 during relaxation, low pressure. Does that mean that you move the blood? That's how blood moves. Blood does not move if you don't have pressure. That's why someone who has hypotension, what do? You want to do something so for the pressure to go up, because if you don't have blood pressure, blood is not moving. No circulation, it's going to promote death. Not good. Not good. It's not good. That's what it means, how to know the venous return. This will be a lot of questions coming out of it due to hemodynamic monitoring. That's what you want to know. Okay. Any questions so far? No? All right, let's go. Let's keep going. Keep going. Just going to touch base on the stuff that are important, not everything. There's a lot here to focus on, to study and all that. So go to page 217 or 217, right column, rule of thumb, highlight it, know it, and just know it for life. This is important, and this is extremely important. And right beneath of it, the headline says, changes in heart rate. First paragraph, please be sure to know it and highlight it because it talks major importance of what's going to happen during increase or decrease cardiac output, so on and so forth. Page 218, that's where you want to go, and you want to highlight the rule of thumb, and you want to highlight 3 lines above cardiovascular control mechanism, which finishes with congestive heart failure, or we know it as CHF. You want to highlight that section. You want to highlight it, you want to know it, see what's going on there. Bless you.
Thank you.
Okay. Any questions so far? No? Page 219. You want to go to page 219, right column, peripheral receptors. You want to go to that section. And you want to highlight baroreceptor or a stretch receptor. What is baro? Barometric pressure. It's a pressure of atmospheric pressure. Barometric. Baro, we're referring to pressure. Thank you. So baroreceptor means receptors that are sensing pressure changes. That's what we want to know. That's how we want to understand. So highlight it all the way to the end because it tells you baroreceptors. Where you saw baroreceptor bold, you want to highlight it, and then you want to go all the way to the end of the paragraph, which is 3 lines, the next page. And then you want to highlight the next paragraph all the way to the end of that paragraph, right above the negative feedback loop. And these areas that you're highlighting, make sure you go back and study it. Make sure you go back and learn those materials. Come back with questions if you didn't understand, so I can go ahead and explain those materials back. Another thing is page 221. 221, left column, 4th line or beginning of the paragraph. Chemoreceptors. Highlight that paragraph and know it really well. Everything you need to know about pH is right there. That's what you want to know. That's what you want to connect the dots together. We are done with chapter 9. We are done with chapter 9. And the time is 3:22. Should we go forward or should we call it off? Or you need to take a break? Go forward. All right. No break? Okay, that's okay. At any given time, if you need to take off, please go ahead and take off. That's okay. No problem. All right, chapter 11. We're going to go to chapter 11. So you want to know the key terms. You want to know chapter outline when you go back to visit whichever chapter that you're going back and study. So we're going to start with page 251. 251. Respiration is italic. You want to highlight it to the end of that sentence. And then the next sentence is on the 3rd line. This complex process involves both gas exchange, highlight, and transport of the gas. So we're not done just because of the gas exchange. We also need to understand the gas transport as well. You should be able to explain to anyone figure 11-1. You should be able to explain to anyone figure 11-1. Put it on the board, explain it to your classmates or anyone that how this cascade down and up works. Oxygen, as you see from air, travels into the cells. And if you look at it, that's cascade down. Partial pressure, again, due to gradient, moves from higher partial pressure in the air, goes into the cell, which is the lowest one. Again, we're talking about gradient. Again, we're talking about difference. Again, we're talking about due to gradient, things are moving, things are flowing, things are moving downward or upward due to gradient. And also, we're talking about carbon dioxide. Carbon dioxide is moving differently, moving opposite of oxygen from cells, which is a higher partial pressure, to the air, which is the lowest partial pressure. That's how the CO2 comes out of the body, and that's how we take O2 into the body. So what are we doing? What are we basically talking about? We're talking about the fact how these two gases, O2 and CO2, moves due to pressure gradient. We'll keep talking about the same thing, different way. We're talking about whether pressure gradient calls for blood to flow or air to flow. Fluid dynamics. Physics calls it fluid dynamics. Physiology talks it diffusion. Respiratory talks pressure resistant. What are we talking about? The same thing, different terminology. So if we know the terminology, we're done. We're good to go. All right. 251, right column, talks about data space. You guys already know what data space is, but nonetheless, highlight it, explain it to your classmates, what is data space? So you can understand and they can understand, and life goes on, and we'll be happy. Everyone would be happy. 252, you already know Dalton's law, which is PaO2 equal FiO2 times barometric pressure minus 47, or water vapor, minus PaCO2 divided by 0.8, or we call it exchange rate, or respiratory quotient. So what we are talking about, that Dalton's law explains alveolar oxygen tension. Be sure that you memorize the formula, number one. Number two, know how to do the calculation. Pretty easy, pretty simple. And if you don't know it, see me, let me know, and I will give you a whole bunch of calculations so you can do it, you become comfortable. Board exam has multiple of these formula. This formula shows up on your board exam, number one. Number two, you cannot use calculator, so become comfortable how to use it with hand. Number three, they're gonna ask you this formula and how to do it in a multiple different ways and variation. So become comfortable. So this is easy. These are easy points that you should gain because these are a straight point. Really, really a straight point. Mini-clinic. Please be sure to study it really well because that mini-clinic talks about AA gradient. Normally on room air, which is 21% FiO2, AA gradient is going to be 5 to 10 millimeters of mercury. You need to know this. And the reason you need to know this is because AA gradient, we're talking about the difference between the alveolar partial pressure versus arterial partial pressure. It tells us how well the AC membrane is working or is functioning. Because if AC membrane is not working well, then we have problems. What kind of a problem we're talking about? We're talking about ventilation and perfusion are having problem, and the problem is going to cause us have problem towards anything else that comes with any of these we have to deal with. But what are we talking about, this AC membrane? Well, how much of a surface area do you think we have if we make the lungs really flat? We talked about this another time also, right? Okay, if we make flat out of anyone's lungs, we're talking about between 500 to 1,000 square foot. We're talking about like 1 to 2 bedrooms. We can make carpet out of anyone's lungs. Now, this area as it is, when it's working like you and I, at its best, functionality of it is not 100%. It is only and only working at 80%. So, what about if 100 square footage becomes a stain? That carbon is going to be visibly a stain, right? It's not going to work anymore. That surface area is not going to do gas exchange. Are we going to have problem at this then? Absolutely. That's what it refers. So the reason we need to understand AA gradient, again, difference. The reason we need to know the AA gradient because it tells us this is normal because we have anatomical, physiological shunt, which is acceptable. Beyond this is not acceptable. It tells us something is going on with our carpet that is a stain. As a result, we don't have a good AA gradient. If it increases, it's not good. It is not good and it's not healthy. That's what it basically means. So that's what we were talking about. You know what? I need to tell you guys